Hi. What is a period? It's a simple question and an obvious answer, isn't it? From a woman's perspective, a period is a bleeding which happens cyclically around the same time a month later. From a health perspective, it's actually not so simple. So let's break it down. To get a normal period, you would need a normal hormonal balance. So these hormones or software need some hardware to work on. We need a normal ovary, which has good quality eggs. And we also require a uterus with a healthy endometrium, which will then grow in response to these hormones. You would have noted that I did not mention the fallopian tubes anywhere. We don't need it for a normal period. We can safely remove or cut the fallopian tubes and a girl's periods will come on schedule. So if we have the hormones of the pituitary gland coming correctly and the ovary receives them and then makes the egg grow, it also produces some hormones which makes the endometrium grow. At the end of 14 days, we will have ovulation. After the ovary has ovulated, it produces a different type of hormone which stabilizes the endometrium. So for the next 14 days, this endometrium is waiting for a fertilized ovum to come and implant. So what happens if there is no fertilization? What happens if a sperm doesn't swim up into the uterus, into the fallopian tube and meet that egg and fertilize? So the corpus luteum, which is supporting our endometrial lining for 14 days, will realize by 14 days that there's no pregnancy coming and implanting on the endometrium. So it withdraws its support. The lifespan of a corpus luteum is only 14 days. Once all these hormones stop, the progesterone stops and the estrogen stops, then the endometrium, which was now well supported, now is not so supported, and the endometrium liberates itself from the uterus lining and falls off. And this endometrial lining or the uterus lining which falls off after 28 days of a cycle is basically your period. So why do you have bleeding when you have your periods? Ultimately, a period is nothing but the endometrial lining falling off, isn't it? Well, once a lining falls off, you'll have raw area and that will bleed. And it will bleed as long as a new endometrium hasn't covered it. Once endometrium has been covered with a fresh layer, then the bleeding will stop. Now this takes approximately 2 to 7 days. Now you would ask, why should the uterus lining let loose its endometrium every month? Why not keep the same endometrium month after month? The reason for this is because your uterus wants only the best for your little baby. So every month, your uterus creates a fresh bed for its little one. And if there is no pregnancy, well, it just lets loose that endometrium and grows a new one. So what is a period? Well, a period is basically your endometrial lining, which falls out because a pregnancy has not started. But for the periods to come, you would require normal hormonal balances, you would require an ovary with an egg, and you'll require an endometrium which responds to those hormones. So in our next capsule, we'll look at variations normally seen in cycle as well as in flow. So, bye.